folks. Welcome to another episode of Tuesday Night Talks. Thank you so much for joining us. And tonight we are going to have on Christine of Healing Soul Transformations. I hope I said that right. She is a lovely lady acupuncturist. She also works with sound therapy, essential oils. I should probably send her the invite link, right? And she is just absolutely amazing. I got to talk to her a little bit, I believe it was on Friday, and I was really impressed with her, and I really wanted to bring her on. She's also a registered nurse, so she's combining Eastern and Western medicine, and I love it. I love herbs and everything. She's not so much about those, but I do love her knowledge, and she works well with kids too. So maybe fingers crossed, if I can get a little extra money up, I can actually go see her about some of Arthur's club foot issues, because I have heard that acupuncture can help relax and release the muscles. Sorry, guys, it's been a long day. I tell you what, we actually had an F1 tornado go through the shop. We literally had it go over the shop and around the area and everything. The place looks like a war zone. So we're going to be closed today. I got to call around and try and find somebody to clear the debris. I didn't even know who to call. As the fire department cordoned us off and said, no, you can't go in there because we had a gas leak. They smelled it all the way up to Isle's funeral home. For you guys watching out there, that's a little ways. And that was pretty crazy. So, but I'm glad it happened on a day when we weren't there. So thank you. Angels and spirit guides were looking out for me. And mine and everybody and all my customers and my baby too, but yeah, it's cordoned off. They're going to come out and inspect tomorrow. Hopefully we get good news. I don't know. There was some damage, a lot of damage. So yeah, thankfully my land people, thankfully they're going to help out and handle that. So, all right, without further ado, here is Miss Christine. Ooh, she's awesome. Now she is over at Unity Center. That's where her office is. She's from California and one other place, but let's pull her on. Hi, Christine.
Hi.
How are you?
I'm good.
All right.
Now, good. I'm not very good at these things because of the lighting, but anyway.
Oh, you'll be fine.
All right.
So tell me a little bit. I did a bit of preamble, but I want you to tell me about you. Give yourself an introduction. And I do apologize. I was going to send you those questions. I'm going to have to do it a little bit later.
Okay.
I don't know if you've seen my shop.
Yeah. Well, I've been in there. Has something happened recently?
That tornado that went through?
Oh, no, I did not see it. I didn't hear.
Yeah, it went through yesterday.
Yeah, well,
thankfully, the shop was closed. Yeah. But yeah, we have some damage, and currently I can't go in because of a gas leak.
Oh, no, that's what you were talking about when I came on. Okay.
Yeah. So it's been a little crazy.
Yeah, a little. Yeah. I was in my apartment when it hit. And I was busy doing stuff, and I kind of looked up and I went, gosh, it looks a little bit scary. I'm going to have to check the news. And it popped up, there's a tornado warning, and then everything flickered, lights went out, things started hitting the window.
We lost power at my house. I was at home. I was getting some work done and stuff. And I'm like, okay, it's just a storm.
Mm-hmm.
That seems a little bit more than a storm. And sure enough, my husband, he went and he checked the shop. He's like, honey. Yeah. I'm like, oh. So, yeah.
I know. I kept trying to figure out how close it was, whether I needed to leave my apartment or not. And as soon as the branches started hitting the windows, I went, yeah, I'm out. And there's a lot of trees down over here on Grand and Ingersoll. It took out the electricity. We were out of power until about 11:30 last night.
Well, but the nice thing is about Mid-American, they get that power on
They did. I mean, it took them a while because some of the trees, these were huge trees. They covered the entire street, and I think they took down lines, but
oh yeah. No, I grew up in Michigan. I grew up in Flint, Michigan, and when you went without power, days would go by.
Oh yeah.
So I'm really happy with Mid-American.
Yeah, they are quick about it. I mean, just as soon as the storm passed, within about 45 minutes, we got notices that they were going to have it up and running, and they were
Yeah.
working on it. So yeah,
So,
it's all
okay.
good.
Well, I'm glad you were safe and
Yeah.
everybody was safe. Did
Yeah.
Unity Center take any damage or no?
No, I didn't see any. I was down there today for a good part of the day. So anyway, well, my name's Christine, and I was born and raised here in Iowa. And then I left many years ago and went and got my training for acupuncture down at Southwest Acupuncture College in Santa Fe, New Mexico. It's a really beautiful city and a wonderful time down there. Um, I graduated in 2009. So prior to that, I was a registered nurse.
Wow.
Did that right out of high school. So I've been a registered nurse many, many years. And so I kind of combine the two. It's an interesting mix. I tend to more like to stay with the acupuncture and not so much with the Western medicine, but it comes in handy when patients come in and they have injuries or illnesses and they have questions and they don't understand it. I can help them with that. So
Now, you also said you do ear candling, right?
I do. So I don't, well, the only thing I don't only do acupuncture. That's what I was trying to start with. I do acupuncture, I do ear candling, I do ionic foot detox baths, I do body and breast thermography. So, yeah,
That's awesome.
yeah.
Now, okay, so we've got some comments. Elena Newton, so glad no one was hurt. How scary. Thank you, Elena. I really appreciate it. That means a lot. Um, and then Stinky N. Hey, can we be friends? Can you send me a link? Send me a link. Okay. All right, girly. I will send you a link to the Des Moines New Age Radio on Spotify where this interview is going to be, just in case you can't follow. Go ahead. Keep talking about yourself, hon.
Oh,
I'm going to
okay.
mute this because my keys are really super loud. I love this keyboard, but it
Okay.
comes through a little loud.
Okay. All right. Well, while I was in acupuncture school, I studied the traditional Chinese acupuncture. I also studied for an entire year doing um, the Japanese style acupuncture, which is what I practice right now. I also studied for a year learning auricular acupuncture, which is acupuncture in the ear. I did some microsystems, and of course, we studied nutrition and herbs and a lot of other things. But I found that I really loved doing the Japanese style acupuncture. And so when I got out, that's what I started practicing. And as I worked with clients, I was trying to find ways that I could get a really good result in less than 3 to 6 visits.
Right.
And so I eventually learned how to use essential oils, and I had learned how to use tuning forks. So I was learning how to use sound and vibration while I was in school. And so I decided to pull those out and begin using those. And then I added song bowls and tincture chimes to that. So yeah, so it's a whole little protocol that I do.
Now, tell me a little bit about the history of acupuncture.
Well, from acupuncture started 3,000 years ago. They say it could be even further back, which I think it is. Um, and it started in China, and it was basically something that they had used to treat pain. And they learned it basically by trying things and seeing what happened and figuring out which points worked for what through trial and error or observation. So yeah, it's been around for, I would say, 3 to 5,000 years. There's 12 meridians in the body. Most of them go up and down. There's one that goes around the body, the belt meridian, and then there's 8 extra meridians also. So
Okay.
yeah.
Now, acupuncture versus acupressure. What are your thoughts?
They're both effective. Acupuncture requires to be licensed. Acupressure does not. So a lot of
Really?
massage therapists will use acupressure in their
Okay.
sessions. You can learn about it and use it in a lot of different ways because it is just pressure points on the body. So, but it is effective. It works just as well as acupuncture. Um, Acupuncture can be done in a lot of different ways. And when I'm talking about acupuncture, I'm talking about stimulating an energy point on the body. So that can be done in a lot of different ways. It can be done through touch, which would be the acupressure. It can be done through needles, which is acupuncture. It can be done through, they have, oh, why can't I think of the name of it? But you can use, it's colored acupuncture. So it's green and red light, that you could use laser or
Wow.
like a laser pointer. You can also use oil on the points. You can
Okay.
use tuning forks on the point. Um, and, even using your voice is a form. If you're activating an energy system in the body, you can use your voice to do that too. So,
Okay.
yeah.
That's pretty awesome.
Yeah.
Now, how long did you go to school for that?
I was there for 3.5 years.
Okay.
They at that time they did have a 4-year program. For
Okay.
those of us that had other degrees, like they gave me credit because of my nursing degree and my
Nice.
years of nursing. And so I didn't have to take a lot of the Western classes, learning how to take blood pressures and all of that stuff. So I was there for 3.5 years. I was trying to do it in 3 because they would allow that. But it got a little bit rough. It was full
Okay.
credit hours every semester, and the one semester I finally cut back. It was 21 credits that I was trying to do,
Oh
so
my
it was a
gosh,
lot. Yeah, yep. So,
that is a lot.
but yeah.
Sorry, I'm also checking to make sure because your camera's freezing up a little bit. I'm
Oh,
checking. I've got my phone up, so I'm checking to make sure we're okay on Facebook too.
oh, okay. Yeah, I don't know why it would be. Nothing is freezing up when I'm talking to you. So,
Yeah, you're. Sometimes the camera will stall up, so
oh, okay.
I'm just
All right.
like I'm checking. I've always got to be sure to check. Those
Uh-huh.
tech gremlins just love me. Now, also, please message me all your info on Facebook so I can put it in the comments so people can get a hold of you.
Oh, okay. Yeah. Hold on. I'll just send it here. So,
Because I know a lot of people are looking for a good acupuncturist.
mhm.
I know I wish there was an amazing herbalist in Des Moines that specialized
Mhm.
in herbs. At one point, when the shop was doing a little bit better financially, I mean, since COVID, it's just been, you
Yeah.
know.
Yes. Yes.
um, but I wanted to actually sponsor one girl to go through and get her herbalist degree.
Yeah. Right now, there are programs where you go just for herbalism.
Mm-hmm.
There's other programs where you just do the acupuncture. And then I went through a program where I ended up with a master's degree in acupuncture, Oriental medicine, and Chinese herbs.
That's
So
awesome.
I learned it all. We had to do all of it. But they broke
Now,
it down now to very specific ones if you want.
now, your business is called Healing Soul Transformations, right?
Yes.
Okay.
Hmm.
Because I'm going to put this in the comments.
Okay. Yeah.
So go
I
ahead.
I up in the chat, I put, my phone number and my 2 locations. So I
Oh,
don't know
perfect.
if you can see them or not, but yeah.
All right. I'm going to mute the mic. Go ahead. Talk about whatever you like.
Oh boy, that's going to be hard. Well, I'd like people to know that part of being an acupuncturist, just like with any other licensed professional, when I got done with school, I had to sit 4 different exams, and I am part of we call it NACOM, National Certification of Oriental Medicine. And so there's 4 exams we had to sit for that and pass to get that certification. It gives us diplomat status, board certified status. So, and then each state has their own requirements also. Iowa didn't have any other testing that I had to do, but other states do require, like California requires them to take an entire other test for their state, and other states require jurisprudence tests and things like that. So, but yeah, it's most of the acupuncture programs are 4 years long. So if you're breaking it down into separate things like herbalism, it could be a 2-year thing, or just acupuncture could be a 2-year thing. But the actual Oriental medicine one is actually 4 years. So
Okay.
yeah.
Now, I'm sorry, I was busy typing stuff up. Did you already talk about what brought you into this field?
Well, and I had been working as a nurse for several years by the time, because I went back to school when I was 40. And so I had been a nurse for, gosh, almost 20 years at that point. And I, how I got introduced to acupuncture is I was having severe morning sickness with my 3rd pregnancy. And I had read a nursing journal that had said that acupuncture was very helpful in chemotherapy, nausea, and vomiting. and stomatitis, inflammation of the mouth. So I thought,
Yes.
well, if it can work for that, it should work for, morning sickness. So I found myself an acupuncturist here in Des Moines. They're still in practice and everything, and got my treatment, and it worked really well. And then, he hooked me up with a midwife, so I kind of went out of the Western realm of labor and delivery, and the midwife and an acupuncturist and herbs and all of that. So it really woke me up to a different way of taking care of myself and my health. And then as the years passed, I have my own health issues, and a lot of the stuff, even now doctors can't really figure it out. They kind of want to attribute it to stress and things like that. And so I basically decided I didn't really much care for Western medicine, simply because it seems to be more crisis management.
Mhm.
It's not quite as preventative.
I've heard that.
And
Yes.
yes, and I was looking for it to be preventative. I wanted
Yes.
to become a nurse so that I could help people be healthy and help them know how to take care of themselves and how to be healthy. And when I got into nursing, I realized this is, it's reactive, it's crisis management. There's very little training and very little teaching of our patients, and helping them to understand how to
Right.
take care of them and how to prevent, disease. So when I decided to go into acupuncture, it came about by a weird way. I knew what it was, but I had never thought to go and become an acupuncturist. And I had somebody recommend that to me, and I said, "Are you kidding? I've got young children. It's 4-year degree. I'm 40. I don't want to go back to school." But there were 2 books that I picked up and read, Web with No Weaver and Between Heaven and Earth. And as soon as I read the first chapter in them, I was like, well, this is exactly what I've wanted to do my whole life. This is my philosophy on health and healing.
Okay. Now
And
hold on. Web
the
with.
Web with No Weaver
Okay.
and Between Heaven and Earth is the second one.
Okay.
Yeah.
And do you happen to know who those are by?
I do not. It's been so long ago, and I gave those books away eventually, but they're very easy to find. So.
All right. And I will tell you, yes, Western medicine, I would definitely say is more crisis management. No, my dad is a naturopathic doctor, and he was single dad, so I had to help him study while he worked, you know.
Yes. Yep.
And so I will tell you, I do prefer prevention. But
Absolutely.
I do want to ask you, I have multiple friends who have it, a lot of clients, and I'm going to ask you, acupuncture sound healing for fibro.
It works really well, actually. I treated a lot of people with chronic illnesses, fibromyalgia, Epstein-Barr, chronic fatigue, Lyme's. That's just a few off the top of my head. What acupuncture does overall in general for anybody, and this is why it works so well for these really chronic illnesses, is it actually boosts the immune system. It tonifies. So, and by that we mean that it nourishes the body. So it's tonifying and nourishing the body. For some reason, I'm just going blank right now because I had this in my head because I knew you would ask something like this.
Well,
it tonifies, it nourishes, it boosts the immune system, it increases the white cell count, helps the red blood cells carry oxygen better. There's just a host of things that it really does. It helps, like with muscle weakness, it helps tonify the muscles so you get better strength and range of motion.
That's awesome.
It boosts your energy. Yeah, there's a lot of good for it. So with the chronic illnesses, it balances things out. It decreases inflammation.
Right.
And by decreasing the inflammation and helping the body stay alkaline, and then we're boosting up its own immune system, then it gives it the ability to fight or to manage or,
Now, my other question is, how long do acupuncture treatments last?
My session, my first session is a 2-hour session because I do an intake. It's quite an extensive intake because I ask everything Eastern and I ask everything Western. And
Oh,
then
no, I mean the results.
the
Sorry.
results last. Okay. That would depend on what you're coming in to be treated for. So basically, when somebody comes in the first time for their treatment, I kind of gauge how the treatment went when they get off the table, and they kind of what were your results, how are you feeling, that kind of thing. If they're dealing with pain, I try to have them come back in a week so I can assess how long the pain relief lasted. So the pain relief can last anywhere from a day up to 3, 4, 5 days. I've had it last an entire week. And the results of the treatments, once you get started, they build on themselves. So if you get,
Wonderful.
yep. So if you end up with like 4 days of pain relief and you come back in at the 5-day or 7-day mark, then after that treatment, your pain relief will probably last 7 days, 8 days, and then so on and so forth.
So it is cumulative.
It's cumulative. And if you combine it with other like massage, chiropractic, energy work, I always tell people if you're going to do that, come see me after that's done because
Right.
the acupuncture will potentiate the results and hold their results longer.
Potentiate. What does that mean?
It will increase the effects
All right.
of the chiropractic adjustment, of the massage, of the energy work. So, yeah.
Okay. And that was actually another thing I was going to ask you. What are your thoughts on Reiki? Does it work well with acupuncture in your professional opinion?
I am a Reiki master.
Wonderful. Okay.
Yes, it works wonderfully well. I've got several energy certifications. I can't even remember how many, probably 5 or 6 different things.
Okay.
But acupuncture is basically an energy medicine. So we are just moving the energy body, the energy in the body through its meridian system. And we're removing blockages, we're boosting up deficiencies, releasing excess. So if you understand that it's just energy, then if you add Reiki to it, or like I've got the 13th octave Lahochi, I've got integrative energy technique, I've got theta healing, I've got sacred geometry. I've done a course in master healing, which is a whole other thing. So there's just a lot of different energy techniques I learned and became certified in before I became an acupuncturist. And
You know what? Sacred geometry. Question. Would you be willing to come on and do an interview on sacred geometry?
well, I could, but I'm not really an expert on it. I just know how to use it on the body.
Okay.
So
Well,
yeah.
no, because I'm looking for a couple of good sacred geometry experts to
Mhm.
really explain the subject matter and how it would work in everyday life.
Oh, okay. Well, when I learned it, the initial class I took, that's basically what it was about. It was learning how to set grids and
Okay.
how to have it help you with just daily life, protecting things, manifesting,
Well, no, that would be wonderful because that way sacred geometry is a wonderful thing, but I would prefer somebody else to talk about it besides me.
Yeah. Well, we could talk about it together. I think between the two of us, we could put a lot of information together. I'm going to have to dig up all my old class notes and everything.
Don't worry, it's going to be a few weeks.
So, yeah. But I do notice that when I'm practicing acupuncture and I'm putting needles on the body, I am using particular, if I'm going to do a triangle and I want the energy to go a certain way, I'm going to place the triangle with the needles in a specific pattern and things like that. Or if I'm going to do a rectangle or, because a lot of the points you can create a circle, a spiral, rectangle, squares, triangles, diamonds. There's just a lot of different ways you can use sacred geometry. And I do have several books on acupuncture, sacred geometry. So
Wonderful.
I've incorporated a lot of different things in my acupuncture. I don't just do acupuncture. I do a lot of other stuff in the session. So
and actually, that's something else. When you talked about grid work, one, Elena, the books are easy to find on Amazon. Thank you, Elena. Wow, you're awesome. Elena's a nurse too, by the way.
Oh, yay. The nurses they really want to be able to help people, and they're finding out that a lot of them are going outside mainstream because we're finding, and a lot of nurses are Reiki. They do Reiki and healing touch. So,
I remember an old friend of mine, her name's Raven.
mhm,
She went through the whole thing. She spent her whole life as a nurse, all that, and she always told me what she should have done. If she could
mhm.
have it to do over again, she said she should have become a patient advocate.
Oh, yeah.
She
Hmm.
always told me, and she's got the fight to do it, okay? She's a Leo. She's like, rare, you know? She will get in anybody's face. And she's tiny too. She's super
Oh,
short, but she's got so much fire. And
mhm.
she always said, she's like, I just wish if I had everything to do over again, I wish I would have become a patient advocate.
Yeah. That's something that I don't know that I'm a patient advocate so much as I can give them a lot of advice on how to navigate the system because of my nursing.
Yeah.
And my primary career in nursing has been working for the managed care organizations, the insurance companies,
Oh
doing
gosh.
medical review, case management, transitions of care from hospital to home, all of that. So I'm very well versed on uh, all the behind the scenes with the insurance and how you, when you need something, I can generally help you know what to ask and the right words to say to your doctor to get what you need because I know what they require for them to get the testing or the.
And that is so important. So you can also be kind of a consultant.
Yeah. Well, I graduated from Southwest Acupuncture College and I have 3,000 hours and I don't even know how many classroom hours, but so many hours in classroom and so many hours in clinic. When I graduated, their scope of practice allowed me to be a primary care physician in New Mexico. So it's the broadest scope of practice in the nation. So
Wait,
they
whoa,
trained,
whoa, whoa, whoa.
yeah,
You were a primary care physician?
yeah, yeah, when I practiced in New Mexico.
Holy cow.
Yeah. So we
Okay.
are allowed to refer out for MRIs and CAT scans and all of that stuff and order blood work and labs and everything and interpret it.
Now,
I personally didn't really like to do that because I'm not a doctor, even though they wanted to say I was. I do have that degree as an acupuncturist, but I'm a nurse and I know where my limits are. So, but I do know how to have people bring in their test results because I read them, every day when I review them for work.
right.
So I understand what I'm looking at and I can help them understand it at their level and
I,
understand this is what's going on. Yeah.
out of curiosity, could you do anything like that here in Iowa?
No, my scope of practice is completely different here in Iowa.
Okay.
I can see patients, they can bring me their results, and as a nurse with my scope of practice, I can teach,
Because,
educate.
well, one of the things I've been kind of trying to look into doing,
Hmm.
it's so needed here, is a sliding scale walk-in clinic, basically just giving a place a free space to do it.
Oh, for like acupuncture or?
Well, also for Western medicine.
Yeah. Well,
Because, I mean, I don't know about you, but stuff's getting kind of scary.
it is. I mean, you can do a community acupuncture clinic with sliding fee scale easier than you could kind of a medical, sliding fee scale. There'd have to be a lot of funding for that, and they're
No, and
limited
that's
through the
one of
government.
the that's
Yeah,
one of the things I'm looking into.
yeah. So it's needed, very much so.
Because
A lot of people don't have insurance, and even if they have it, they can't afford to use it.
yeah, that's the kind of the sneaky thing. Oh yeah,
Hmm.
you've got insurance. No, you really don't.
Yeah,
You really don't.
no,
You
you're
know.
paying a lot in your premiums, then you're paying your copays, then you're paying the deductible, and then yeah, some of your stuff isn't covered if you don't. Yeah, and I've been navigating that world for I don't even know how many years now, 20 or 30 years.
Right.
So I understand it very well, and you know, I'm very frustrated with the system. It could be better, but it's what it is here in America. So
Elena, I find this interview very fascinating. Thank you, Elena. I appreciate
well,
it.
thank
Mwah.
you. Yeah, thank you. So
Um, and then also, I wanted to talk to you. You were talking about grid work. Have you ever used crystal gridding and crystal healing in your practice?
my office is crystal gridded. And yeah, I do use crystals in my sessions. I have a huge blue kyanite under the table
Nice.
with selenite on it.
Okay.
Everybody gets that when they lay on the table. The room is gridded with Lemurian seed crystals.
Nice.
And then, for my finances, I put a little citrine in the money corner, and because I do feng shui the room. So yeah.
Now, do you use feng shui just for yourself, or do you also consult for your clients?
I just do it for myself.
Okay.
I have a really good book that most anybody, I've had it for years. It's Feng Shui for Dummies.
Nice.
And it's very simple. It's very clear and understanding. And so, yeah. But yeah,
Antoinette.
basics.
Hello. Antoinette is the energy worker that comes through the shop. She's amazing at house clearings, blessings. She is awesome at negative entity attachment removal, and she's great with Reiki.
That's great. That's great.
Thanks for joining us, Antoinette. Awesome. She's
Yeah.
probably joining us between sessions. Here we go. Elena, we see too many people fall through the cracks, unfortunately, due to a lack of insurance. Okay. That we were just talking
Absolutely. Absolutely. I agree with you. What I found, a lot of the people that show up in my office have exhausted all the Western medical options for what's going on with them. And so they're coming to me,
Yeah.
hoping that acupuncture can help. And, a lot of them found, the ones that were dealing with chronic illnesses, found that doing acupuncture regularly, even if it was, once a month, once every 6 weeks, which is what most of my patients were. I didn't have to see them every week or several times a week. As a matter of fact, I don't really see anybody but once a week. Even after their first session, I don't require them to come any sooner than that. But I was finding that they were their medications were being decreased or discontinued, and they were sleeping better. They were managing all the conditions better. They had more energy. Their immune systems were stronger. Yeah, and some of them came specifically because they just didn't want to be on all the medications they were on, and they were hoping that I could help them figure a way out of that and go on to herbs. And I will never help somebody get off their medications without a doctor.
Well, yeah, obviously.
And going on to herbs, it can be wonderful at the same time, but you have to understand that a lot of people are on their prescription simply because they can't afford to do the herbs. So herbs are not cheap, and they're much more complex to take than a simple pill. And then a lot of people, their copay for their pill is $5, but their herbal prescription may cost them $60.
I was going to say that is not my experience at all. Most of the prescriptions are pretty hefty.
Well, yeah.
Most
So
of the
for older people, like on Medicare and things, like I'm talking blood pressure pills and things like that. There are a lot of prescriptions, any respiratory inhalers, things like that. They're crazy expensive. Diabetic meds, depending on what kind of steroids and things you're on for your chronic conditions, that can be quite pricey. I'm talking just simple things, like I would have people wanting to get off their blood pressure meds or off, things like that. And they come to find out that it was just cheaper to stay with their prescription than go with the herbs. It's more work at times, but it is more natural.
I was going to say, for most of the stuff that I know of, most of my clients that use herbs instead of prescriptions, part of the reason why they do it, they get the same effects without a lot of the side effects, and it's also cheaper.
Exactly.
With the herbs. But the other thing I wanted to ask you, it's a long shot, but can acupuncture do anything about diabetes?
Yes, it absolutely can. Yeah, it will drop your blood sugar. I typically will tell people that have hypertension or high blood pressure or high blood sugar issues after sessions with me, for the next 48 hours, they need to monitor their blood sugar closely and their blood pressure closely, because they will have a significant drop.
Really?
Yeah. I actually had a guy come in one time for a session, and he was on a insulin pump, a pump that did insulin continuously, and then a monitor that monitors blood pressure continuously. And that's fairly common these days now. Back then it wasn't. So he came in and I did a session on him and treated him for the blood sugar issues that he was having, his diabetes and whatnot, and any of the other stuff going on with him. And he actually got back to me, and I saw him for just a few sessions, but I kept in touch with him for quite a bit after that. And even 3 months later, he had told me, he said, just from that initial session, my blood sugars have been much lower. They have been more in range. They have stabilized. I'm not having the wild ups and downs. He said, whatever you did, it really stabilized
That's
and
great.
it's manageable. Yeah, yeah.
I know a couple of people that are on the Ozempic, I think, diabetic medication, and they're dying. I mean, oh my
Hard
God.
medication. Yeah, yeah.
And that's part of the reason why I asked, because it might or might not work, but I can refer them to you, and maybe you can give them some relief so they
Get
don't
sessions
have.
with me. You can see what happens with their blood sugar.
Yeah.
Definitely, I'm not ever going to say that they'll be able to come off all their medications. I don't know
No.
what type of diabetes they have. I don't know how long they've had it. I don't know any of that yet until I have my session with them. But I do know that it will lower the blood sugars and it will control diabetes, and it may cause them to have to lower their medications or change or decrease. Some have to stop their medications or they change how they're doing it. If they're on 2 medications, they may get to go to just one, which may have less side effects than the other. And the same thing that happens with blood pressure issues. It's the same thing. A lot of them, if they get sessions and they stay kind of in a maintenance phase with me, even if they don't, they do find that their blood pressure drops and it stays down and they can lower their medications. Some people have been able to come off of it. So with any of those chronic illnesses, that I saw that very consistently. People coming off of steroids that they didn't want to be on, and lowering doses of other medications that had side effects. And I mean, I've dealt with a lot of severe chronic illnesses that have to be highly managed.
Yeah.
And because of my Western medicine, there's things that pop up in my sessions that, just for example, I had a guy come in and, he had a heart condition and water retention, and he had said that his weight had gone up a few pounds and he had more fatigue and this and that. And I said, well, did you call your doctor? I think you need to, because your medication might need an adjustment. I think your congestive heart failure is getting worse. And he says, well, I don't really want to. And I said, I just really would like you to. So just call him and ask him. And the doctor had him come in. And he said, well, why did you think to come in? And he said, yes, you're going into heart failure again. And we need to take care of this. And, he said, well, my acupuncturist noticed it and told me to come in. And I had another guy in my office. I wouldn't allow him to leave. He refused to let me call an ambulance. He eventually did call an ambulance, and he was having a heart attack in my office. And so having the Western medicine has helped me a lot as an acupuncturist. And I do have, even though I personally prefer not to have Western medicine if I can help it,
Right.
we do need it.
Yeah.
We have to have them to put us back together when we have broken bones and accidents and trauma, or when we need surgery. They're absolutely necessary.
It is there for a reason, but
a reason. Mm-hmm.
there are things we can do better before we get there.
Exactly. There's a lot of educating that goes on in my office, and I, even on their disease process and how they can manage it better, things that they can do nutritionally, lifestyle, herbal. If the herbals can be combined with the medication, I have to be very careful about that. And because of that, I decided not to really pursue being an herbalist or use herbs in my practice. I chose to use essential oils instead.
Right.
So
now, quick question. Hormonal imbalances, that's one of them.
Right.
Can it be helped by acupuncture?
Oh, yeah. I mean, I treated infertility and PMS and menstrual problems and menopause. It's all very easily managed with acupuncture. Yeah. So we can stop night sweats. We can stop hot flashes. We can stop menstrual cramping. We can get our period going regularly. My fertility treatments were at 90%. There was very few that I did not help them get pregnant, assist them in getting pregnant. So yeah. Yep.
Okay. Now, Elena has a question. Here we go. Elena, do you know a difference between type 1 and type 2 diabetics and how they respond to treatments?
Well, with type 2, that's more of a diet related one. Type 1 is your body is not making insulin, it's just not there to even manipulate. So, type 1 is a little bit more difficult to regulate. You've got to watch them closer. They'll never come off of the insulin. That is just, you've got to know that right up front.
Right.
So when you're managing them, you've got to be very careful in what you're doing with the acupuncture. It can cause sharper drops, and then the type 2. So with type 2, generally, they do have to watch their blood sugar. Sometimes they end up on insulin. Most of the time it's oral anti-diabetic agents, but sometimes they will have to have insulin. And they can have blood sugar drops with that, but theirs is a little bit easier to manage because they can add food, they can eat something. Sometimes they can increase their insulin dose a little bit, things like that. But, I try not to be a diabetic nurse manager for anybody, so to speak. I do talk to them about I ask everybody what their allergies are, what their medications are. So I love to have a nice long list of medications, what you take them for, how often do you take them, are you taking any supplements or any herbs in combination with that? Because I need to know when I'm recommending things. And I don't very often recommend much of anything if I don't know for sure what they're taking. And also sometimes patients are not always honest. Any nurse will tell you. They will tell you everything that they are doing. And that was another reason I chose not to do herbs, is because I had an anaphylactic reaction and my throat swelled shut in class after I took very, very gentle herbs, very calming herbs, and I reacted to them and ended up in the emergency room. And everybody was shocked. So I'm not comfortable sending patients home with an herbal remedy that I don't know what else they're combining it with. So
had the same nasty reaction to both penicillin and salmon.
Oh yeah. So yep.
Judy Zeitz. Good evening. Good evening, Judy. Hi. Thanks for joining us. And then Elena Newton. Thank you for your answer.
You're welcome, Elena.
Thank you for asking the question, Elena. Now, also, I'm going to throw a couple more at you. Anxiety and depression and insomnia.
Depends on the insomnia. I'll tell you that. There are some that are just tough. And if that's a kidney deficient insomnia, it's a harder one to treat. But I have been able to get people to sleep a little bit longer and get more restful sleep. And a lot of times if it's, I'll ask a lot of questions about their insomnia. There's just tons of questions we ask about every disease process or any complaint. And depending on what that is, sometimes I will recommend that you might have sleep apnea, you may have a sleep disorder. Have you had any sleep studies done? Have you talked to a doctor about this? And some people just are not sleepers. They never have been from day one. But they do burn up their adrenals because they just don't sleep. You need to rest to reset your adrenal system. Anxiety and depression, that is my specialty. I treat trauma, PTSD, anxiety, depression, addiction. Yeah. I worked in addiction and recovery for 1.5 years in Nashville at the Integrative Life Center. And so I learned very quickly how to get people out of panic attacks. And I myself have a background of anxiety and panic attacks. And so I know exactly how that feels and how quickly you get gone. So I learned very quickly to do that.
Okay. And then back pain, back trouble, basically back just completely going out.
It depends on the type of back issue going on. The easiest ones to treat are ones that have not already had surgery. So if you've already had surgery and you've had back instrumentation put in, you've been through a series of steroids and things like that, it's a little bit harder to treat, but it's not impossible. Okay. And I found that anybody that comes in with any kind of pain is very easily treated for the most part. Okay. I use sound, and that's why I started using sound, and I started using tuning forks. I use ohm frequency tuning forks. When you use them on the body, they go to the cellular level, get all the cells vibrating at the same frequency, and therefore it alleviates pain. It's one of the reasons I get a pain reduction of 50% or more off the table for a session. So that's very hard to do. And a lot, just ask anybody in pain. Nothing seems to help. Nothing works, blah, 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 blah. So I have.
Oh, honey, I don't have to ask anybody in pain. Okay.
Yeah, yep.
Elena Newton, how about GERD or reflux? Is this manageable with acupuncture? Good question, Elena.
Yeah, it is. It is. We have points that can direct the energy to flow downward. And then I always ask them if they've ever had any testing done, what kind of medical testing have they had done? So if they've got a hiatal hernia, then they're going to have GERD and reflux. And so, then that helps me direct how I'm going to manage it. I do ear treatments. That's just something I study. And there are points in the ear to treat that literally. And then also points on the body to do it too. So, and I can advise on other things to take too to help with that. There's natural supplements that you can take. Dilimanone, I think that's how I'm pronouncing it right. I might say it wrong, but it is the orange peel oil that's concentrated, and you can take that, and that will help with heartburn and GERD. And and then of course nutritional things and dietary. And some people have it bad enough that they do have to be on, like protonics and things like that, unfortunately. But I have seen people come off of it after treatment. So yeah.
That's amazing.
Yeah.
So I guess the question is, are there any things that you absolutely do not recommend acupuncture or the things you do for? Oh, and then also I want you to tell me what's involved in a session, how long, and how much.
Okay. Okay. There's really only one thing that we were ever told that we can't say that we treat and manage well is cancer.
Right.
We don't treat cancer. We treat symptomology. So in most people, when they come to us, they're not coming to us to treat the cancer anyway. They're coming because of the side effects of their treatment.
Right.
And that's what we can treat. So as an acupuncturist, I can never say that I can cure anything.
No.
And doctors really can't say that either. We can treat and manage and see good results. So, but anything I've just had, there's just been, I can't think of anything that I haven't. That's exactly why my intake sheet is so long. So anything can walk through the door and I'll be able to do something with it with acupuncture.
Even people with autoimmune issues.
Autoimmune, yes. Yep. Wow. Absolutely. Okay.
And I remember you originally, and I had also read that acupressure can help with chemotherapy side effects.
The side effects of it, yes. It can absolutely help with the nausea and the fatigue. And sometimes it can help even with the weight gain that you may have, depending on how the water is distributed because of the cancer. Sometimes it gets stuck intracellularly and you really have a hard time getting that out. Other times it's just underneath the skin, and we can get that to, I can get anybody to, lose water weight. It's just simple points and some oils on it and things. And so it's, when I look at it from a Chinese perspective, Japanese perspective, we can treat anything because what we're doing is just balancing the body. Mm-hmm. Just bringing the body back to balance and allowing it to have its own immune system back up and running. And our body is designed to heal itself. You cut yourself, it heals. We don't do anything to it mostly. It just heals. Skin just grows back, stitches closed, we're good. Our entire body can do that. We just don't think it can. And some things, I don't know how easily we could, heal a broken bone, by, there's still that Western medicine common sense side to me, but there is that very much Eastern philosophy of understanding that we are designed to heal ourselves. We do have the abilities to understand our body. We are our best barometer of what is going on with us. We live in the body. We live with the disease. And it doesn't matter if you say something to your doctor and he says, well, that's not common. It may not be common, but this is what I'm living with.
Yeah.
I learned the most from my patients. I have learned more from my patients than I ever learned working as a nurse.
Nice.
They're advocates. They're doing the hardest research. They bring me the most information about their disease process, what's out there, how it's being treated, what works, what doesn't work. All of that knowledge that they bring to me from them dealing with it and combined with what I can help them with, then that gets spread out to other patients that come in too. So it's really a collaborative thing when I have patients. I learn probably more from them than you do from me. So, yeah. So, I do a Japanese style acupuncture. It's a balancing technique. So when you come in, the needles are going to be very shallowly inserted. They look like they're just barely hanging in there. And I tell people you have to dig deeper for a splinter than how deep these are going to. They literally just barely hang in there. And then we also use 800 Gauss magnets on points on the 8 extra ends, and then we'll take that off and little tiny OQ marks, so tiny little threads, and that nourishes and tonifies and relaxes and relieves pain. It's a balancing technique. And part of the treatment that I also do is I actually open and balance the entire chakra energy system.
Ooh.
I clear out cellular memory. I repair the holographic DNA. I work on ancestral patterns and helping to clear and heal those. I use sound. So you're getting song bowls, tincture chimes, and tuning forks in each treatment. I use the essential oils instead of herbs. And so as long as you don't have a sensitivity to oils, I will put those directly on the body.
Okay.
So you'll get a little oil cocktail right in the belly button. And then you'll also get an oil treatment on the back, which is not the raindrop technique. I don't do raindrop technique for anybody's. I don't do that. I don't necessarily, I never learned it, and I don't think there's anything wrong with it, but I just don't do that. So because of my understanding of the energy body and what we're
Right.
doing up this, it's a very, yeah, the back of the body has a lot of major openings into the organ systems in Chinese medicine, as well as the front of the body. And so I'm very careful about, how many oils go on the back. Right.
Yeah.
So that's all I'm going to say about it. But people love raindrop therapy, and it's great. I've had it done, and it was a nice session, but I just personally am not comfortable doing it myself. So, but anyway, so
I've had raindrop therapy, and I don't know. It doesn't do it for me.
well, there's some oils on there that I have been trained not to use on
Okay.
skin, period. And that was part of it too. So the other thing too, you have to understand, I have so many classes and certifications in essential oils. So when I was trained by acupuncturists that developed their own oil lines, so I only use their lines. I don't use doTERRA or Young Living or Acacia. I don't use anything off the shelf. Mine all comes from my acupuncturists and that I work with, and then also other oil companies that are highly rated that I've got a list of if anybody's ever curious. And they're not too expensive. That's why I like mine. They're relatively reasonably priced and they work well and I love them. Anyway, so my first session, you're going to come in. We're going to do an intake. And that is literally, it's a 4-page intake. And then you've got this signature pages and things. And then I'm going to go over that intake with you. I'm going to ask a bunch of questions. I'm going to get all my information. I'm going to check your pulse, look at your tongue. I'm going to at least check your pulse ox and stuff. I always pop that on since COVID. I just got into the habit of that. And then we're going to go ahead and get on the table and do a treatment. And so, yeah. And then you're going to be face up, and I'll do a treatment on the front side of the body. When I get done with that, then I'll have you turn face down, and I'll finish up on the back side of the body. And when you go face down, that's when the sound therapy comes in. I'm actually balancing the right and left brain. I'm activating the pineal gland. I'm balancing the cranial sacral rhythms. I'm tonifying all the major organ systems in the body with the tuning forks. And then the song bowls and the tincture chimes set you into a theta brainwave pattern. The song bowls actually get out into the outer energy fields and bring that energy back in for processing. I don't tend to say that I'm going to clear, like get rid of. I like to bring things in for you to process through your chakra energy system, which is why that's opened up when I start the treatment. So, yeah. So it takes 2 hours. It takes longer for the first session.
Sorry, I've got an alarm going off over in the living room. I'm like, what?
Uh-oh. And then the follow-ups are generally an hour, hour 15. So the first session is $150. The
Okay.
follow-up sessions are $100. You are the only patient that I'm seeing. I do not run multiple rooms. This is a one-on-one, just as if you were in a massage therapy session. They're not leaving the room to go see anybody else. I'm not leaving the room to go see anybody else. I
Okay.
am there the entire time. You are going to feel me touch you several times. I'm checking pulses multiple times. I'm running meridian lines on the body. Um, I'm assessing injuries. I can feel by touch where an injury starts and ends. I can see it also on the body. I can tell if it's an old injury or a new injury, things like that. I do have other abilities that I can, I get a lot of guidance. I have my guides in the room with me, and I can have your guides in the room with me, talking to me too and guiding me in your session. So anyway, I do have other options. I have a bunch of different packages. Also, I do calling in the ancestors and 12 spirit points, and there's just different protocols that I can do. And for those of you that would like to have acupuncture with me but can't afford that price, I do have just a basic. I can just do the basic Japanese treatment. For initial one is 80, the follow-ups are 60. You will not get the sound and you will not get the oils. You'll just get the basic treatment, which is still the front treatment and the back treatment. Yeah.
Well, my other question is, do you take insurance? Do you take state and things like that?
I do not. That takes quite a while to get yourself registered in that. And then there is a lot of behind the scenes work to stay as a provider for those companies.
And I had heard that. My chiropractor that I go to, Brockman Chiropractic, love him. Very old school dude, but I love him.
Yeah.
And he's actually the one I credit for getting me back up and walking. My
Yeah.
back went out several times through my life, and then finally one day
Uh-huh.
I was on my back and I wasn't moving.
Right. I've been
So, okay, all right, you get it. Wow. And my friend Katie, she actually recommended him. She was a massage therapist. The same thing happened to her.
there.
She was on a cruise ship.
Uh-huh.
Cruise ship went one way, she went the other. Yeah. Okay. Well, Katie recommended me to go to him, and she even gave me most of the money to go see him because obviously I can't work. I can't do anything at this point, I went to see him. He put me back together after several things, but I always asked him, he's like, yeah, no, I don't take insurance. So it's like, okay. But he's amazing at it.
Yeah. Yep. Exactly.
So.
I don't have insurance, so I pay cash for everything I get, for all the care that I get. And so I get where people are coming from with that. And if you are fairly healthy, then, and you know how to take care of yourself, I have to say, I mean, I've been lucky and I've been able to navigate without insurance. I can't afford insurance. Honestly, I can't afford to pay the premium. I can't afford the deductible. I mean, if I can't afford to pay $6,000 out of my pocket for an ER visit, I can't afford the policy, is how I look at it. So,
well, and that's the other thing. I mean, that my son, he was born with clubfoot and everything like that. And guess what?
yeah.
To even breathe the air in that doctor's office is $1,000.
Oh, yeah. Yeah. It's
Okay.
expensive. Healthcare is really expensive. Yeah.
So I ended up having to go on state care for Arthur.
Yep.
Which, of course, got cut off.
Yeah.
Yeah, I know. Right. But no, yeah.
Yeah. I did, for 5 years when I lived in New Mexico, I did work with the VA. So I was on the VA as a provider.
Oh, that's awesome.
By the end of the 5 years, they had whittled down my reimbursement to so little that I couldn't afford to continue to do it. I was whittled down from 250 a visit to 50 a visit. Yeah, and if I'm running one room and only getting $50 from them and no other copays, so
you can't stay in business.
Yeah. And the thing with filing the insurance too, I mean, we can put other charges on besides the acupuncture. We can charge for an office visit. We can charge because we take vital signs. We ask specific questions. So we were able to charge more for that, and that's why a lot of acupuncturists like to get the insurance because they're able to charge more. And it's once you're in it, it's a steady stream of income. The problem is you've got to have the staff to follow up on the claims and make sure everything's paid properly, or to follow up if it's not, or deal with the insurance company. And so I alone, as a single practitioner, I loved treating my vets. They were
Yeah.
some of my best customers, and they were so appreciative. But
Well,
I couldn't continue it at that rate. So,
and that's another
I learned a
thing.
lot about it. So.
One of the two questions. One, can you treat PTSD with this?
Absolutely.
And then two, I know with Antoinette and I, when we get house clearings and negative entity attachments and stuff, anytime there's small kids, we immediately go pro bono because we know that family's already on its knees.
Right.
Do you ever do pro bono work? Do you volunteer or anything?
It depends.
Like at the VA or something.
Right now, I'm not doing any pro bono work because I'm just getting started. So in the past, what I used to work at community acupuncture clinics, and so that doesn't pay an acupuncturist a whole lot of money, but it gets people in, and they're able to get their care on a sliding fee scale, and you get to see a lot of patients and things like that. And then I also, when I worked addiction recovery, I got paid very little for that. It was really a labor of love. I had a lot of fun learning about addiction and recovery, and there are just certain people and their addictions that needling is not the smartest thing for them. So
yeah, just a little bit.
Just a little bit. It's a little triggery.
Yeah.
But I did learn a lot of different protocols to deal with addiction that isn't just the typical addiction protocol that most acupuncturists learn. So,
And I'm not in any means trying to put you on the spot, but I was curious, And then the other thing is, what is your goal with a client, with any client? What is your goal summed up?
My goal is what they come to me with their goal is. If their goal is, I want to be golfing 3 times a week again, that's my goal. If their goal is, I want to be able to stand longer than 15 minutes without pain, then that's my goal for them. Okay. I don't create a goal for them. I ask them, why are you here? What do you want me to help with? And you have 1, 2, 3. What's your top? If they say 1 or 2 things, I said, is there anything else you want to work on? I don't care what it is. And they said, well, I just want to feel good. All right, then we can do that too, or I want less stress, or, if they come in with the goal of, I want to be off all my medications and this and that, then I have to have a nice little talk with them about that. But I can talk to them about how to possibly reduce the side effects, reduce the dosage, as long as we're talking with your doctor. So therefore, I do have release forms if I need to share information with anybody else, with a doctor, with a family member, exchange information. I do that also because I treated people in motor vehicle accidents. I worked at a clinic where that was all I treated, was people that came in with motor vehicle accidents. And I've had to submit, records to lawyers and, all of that. So it's,
Now, of course, I'm going to ask, because vanity is vanity. Weight loss.
It can help with weight loss, mostly through detox, balancing, alkalizing, and helping to decrease the cravings.
Okay.
So, and it really, like I tell people, in any, like a weight loss or even an addiction, like stop smoking, things like that, I say, I can get you to a certain point, but this has to stop. You have to control this. What you're bringing to your mouth, you have to ultimately control. So, but there's a lot of education too with weight loss, and people don't understand what they're actually doing with their diet that contributes to weight gain.
Now, let's say somebody is pretty on the ball, pretty healthy and everything. They're having trouble with some other stuff. How long would you say it would take
for weight loss?
For it to actually start showing, for some of the pounds to start dropping off?
Oh, that is a question I don't know that I could answer honestly. Because what I would be working on, if you're fairly healthy, you got a clean diet, you eat regularly, you're resting well, then I've got to look at whether you've got, a cortisol thing going on, like if we need to, help balance and decrease your cortisol levels. Because a lot of people, their weight gain is a lot of stress and just
Yeah.
this modern lifestyle. So, making sure that they're drinking enough.
Say it louder for the people in the back, because nobody wants to believe me when I say that.
A lot of the weight gain is our modern lifestyle and stress.
Yeah.
We're not sleeping well. We're not resting well. We're not, our cortisol levels are through the roof.
Okay, I'm just going to cover the camera there. Yeah, you can't see me. You can't see me.
Yeah.
Yeah.
And so that's kind of what it comes down to. So, and then not really understanding, what's really healthy and what's not healthy. Because a lot of people think they eat fairly healthy, but if they're not reading the labels,
Yeah.
Years ago I took fructose and corn syrup and all even if I buy a canned product, if it has more than 3 ingredients, I don't pick it up.
Yes.
Salt, water in the product, that is it.
Yeah.
Otherwise, it's got chemicals that are going to mess with your hormones. That's the other thing part of weight loss is it's hormone balancing. So, because when you come in with weight issues, you're not only dealing with the weight, you're dealing with stress issues, you're dealing with hormone issues. Most women will come in and they'll have horrible PMS, irregular periods, they'll have horrible periods, they'll have women come in menopause and they're just like, I don't know how I put 20 pounds on this month or this year. And it's like, or sometimes even 10 pounds this month. And it's like, well, what's going on with your hormones and your menopause and where's that at? And, there's a reason why elderly women look the way they do. Our hormones help control our weight and our weight distribution also. So, yeah, I mean, there's multiple factors that I look at, and I worked with several people that were in weight loss programs. And I actually worked with one lady because that was her reason for coming in. In the end, we found out she had a genetic disorder that caused her weight. And she was seeing, specialists for her weight loss. She'd gone through surgery a couple times. She just couldn't lose it. And she finally got into a study in Vanderbilt, and they found out that she had a genetic mutation, that she had, other things going on, but that was part of the genetic mutation was the weight gain. And that's why it was so hard to control. And it was just a simple injection that she had to take that helped her start losing weight. I mean, by no means is she, 120 pounds and whatever, but she's lost significant weight for her that makes it healthier. And that's another thing too. You got to understand what the reason is for the weight. Reason for the weight loss is: are you looking for is there a health issue that you need to lose it for? Is it, there's just, people have different reasons why they want to lose it. So,
well, I mean, excess weight, what is it? Every extra pound puts 6 pounds of pressure on your hips and 4 pounds of pressure on your knees.
Yep, exactly.
So if you're 100 pounds overweight, that's 400 pounds on your knees.
Exactly. And I have people come in for that exact reason. They've got anything. And the ironic thing is you get into a cycle where you're overweight, you're in pain because you're overweight, and because you're in pain, then you can't exercise. So then the weight, you're just stuck. So a lot of times people come in and we can get some of the pain managed so that they can get out walking or exercising. And then that adds to the ability, to be able to start that part of the program. Because you do have to move to, get the weight off. It's not the sole reason, but yeah.
Most of my friends and I, we fall into 2 groups. One group, you diet, the weight comes off. The other group, you got to move, and the weight comes off. Exactly. I fall into the movement group.
Right. So
the only thing I cannot touch is cheese. If I look at a block of cheese, it will put 10 pounds on me.
You just strap it to your hips.
I know, right? That's pretty much it.
Sure, because that's where it goes.
But I love cheese. I'm also lactose intolerant. Funny enough, right? The irony. But no, As long as I'm moving.
Yeah. Ironically, we do crave the things that we are intolerant to, and it's because the body is trying to replace what that item has.
Oh, that's
So
interesting.
if you can replace,
Mhm.
what nutrient that your body is lacking and it
Mhm.
wants that, because I will tell people to eat intuitively. So if you're craving ice cream for a day, eat it. You're probably missing some nutrient that day from something you did a week before. It's an odd thing, but I do tell people to do that. And ironically, the very things that they crave are the very things that cause them a lot of problems, because they're trying to get that in a way that they know how, but the body's like, not that way. So,
I-
yeah.
but
Anyway,
no, I can literally eat anything I want except for cheese as long as I'm moving.
yep, yep,
All, just constantly moving. However, with my back problems,
yeah, yeah. Hmm.
changed everything. People will look at me sometimes and they're like, "Oh, you had a kid." That's why I'm like, "No, he had nothing to do with it. I literally gained 60 pounds during the pregnancy, dropped it all the first month."
Yeah, yep.
You know, so they're like, "What?"
No,
I'm like, "No."
pregnancy is not the cause of women being overweight. Sometimes hormone imbalances cause problems. Sometimes if you've got polycystic ovarian syndrome and it's not well managed, and that is something that I can treat also. But I do recommend that you do work with your doctor about it, because it is, you know,
Oh
they
yeah,
do use medications to help manage all those different, well, the blood sugar in particular, and all of that. Plus, you've got to be aware of all of the other symptoms that can happen and become an issue with it. So, but I had people come in with polycystic ovarian syndrome, and they got pregnant, and so it doesn't stop you from having a full life, and they were well managed, and yeah, they felt the acupuncture helped balance things a little bit better. So yeah,
that is
so
awesome.
yeah, yeah. It's all like I tell people. I mean, when they ask, do you treat? I'm like, I treat whatever walks through the door, because for me, I am balancing you. I'm not at war trying to get rid of anything. I'm
Mhm.
trying to bring you back into balance, your natural state of balance. And I can do it with acupuncture. I can do it with education. Um, so, yeah,
Well, that is absolutely awesome.
yeah.
So, is there anything else you would like to talk about?
Um, Well, I've already told you all the other stuff that I do. Interestingly enough, the ionic foot detox baths are really helpful with weight loss, allergies, things like that. Simply because they do alkalize the body, and if the body is in an alkaline state, then it naturally goes back to its natural state. So we all carry a normal weight that our body likes to carry, and that's another thing we have to learn to accept. That we may not like the number on the scale. Sometimes we just need to throw it away. I used to work in weight loss clinics
Oh,
some
oh, oh.
years ago. So there's lots of little tips and tricks that I've learned over the years. And the biggest one is, don't get hung up on the number on the scale. Get hung up on how you feel, how you move, how your clothes fit, and how your health is. So you can be very healthy and be, quote, overweight.
Mhm.
You can be very ill and be perfectly at a perfect weight and be very ill. So
No,
there's such a thing as being skinny fat,
I
truly.
actually got really sick. My dad won at the horse track and he sent me out to the Star Trek experience in Las Vegas. I got so sick beforehand, I almost didn't go, but I was like, no, I gotta go. This is a once in a lifetime gig. I got there. It was hot. I was sick. I was walking everywhere.
Uh-huh.
I got off that plane and I still have pictures. I slimmed right out. Okay. I dropped a whole bunch of weight.
Yeah.
When I got off that plane, I looked like I had some debilitating wasting illness. I'm like,
Well,
oh, I'm never getting that thin again.
yeah. Yeah. I mean, everything is personal preference, and you know how you feel best, and what weight and where you're at that you feel best. It doesn't, And I tell people too. I mean, I'm in the medical profession. A body is a body. So if you're concerned about something, we're going to discuss it. If you come in and you're not talking to me about your weight, I am not talking to you about it. If you are not talking to me about your mental health issues, I'm not going to pick on you about it. I'm not going to bring it up. There'll be questions to ask. If you want it addressed, it will be addressed, you know. So I'm very much about what is your goal for being here, and then we go from there. So, but the ionic foot detoxes are really good for, as part of a weight loss protocol, just to alkalize the body. So, and put it in that state. So, it's also, the one thing about cancer is cancer can't live in a body that's alkaline.
Really?
Yeah. So it thrives on sugar and acidity. And so, yeah, if you
So,
have a more alkaline body, then you're less likely to develop a cancer. It's been
so
proven.
wow. So I guess another question, how outside of different stuff, just daily everyday life, how
Mhm.
would you turn your body back to more alkaline?
Well, you'd get rid of all the processed foods. You'd get rid of sugar.
Okay.
Those are the two key things. Yep,
Okay.
sugar and processed foods.
Okay.
So, um, you do need to get some good rest, that's for sure. Making sure you're getting at least 8 hours a night of rest.
Mhm.
Decreasing any stress that you've got, because cortisol raises, all of that. When you get with the stress, the cortisol level goes up, and the body isn't as alkaline with that.
Okay.
So, yeah. Uh, Alcohol, cigarettes, recreational drugs, those need to go. Yeah. Kind of all the fun stuff is how I call it. But it's not, I mean, eating a holistic diet, all natural foods, whole foods.
Okay.
So, being aware of healthy fats that you're cook with or eat.
Okay.
So, being aware of, a lot of dairy products have growth hormone in them. So, you've got to kind of watch that kind of stuff. There's just a lot of little changes you can make to create a more alkaline environment in the body. So,
Now here's another question. What about coffee?
well, coffee's very acidic.
Damn it.
And it
Oh
can be
well.
good for you. I mean, they have shown there's positive studies for what coffee can do for you. From the Chinese perspective, the worst thing to do first thing in the morning is to dump a pot of coffee or a cup of coffee onto your adrenal system. You're just waking up. And what it's like, what it's akin to when you wake up in the morning and your body's all quiet and relaxed and you dump a cup of coffee, caffeine on it, you're sitting with the foot on the brake and another one on the gas pedal, and you're just revving. And what are you revving up? Your adrenals. What are you going to do when you sit on a brake and rev? You're going to burn out. So, yeah. And you should
Here's
never
another.
put cold on the stomach first thing in the morning either. So,
Actually, well, if I was more responsible right now, but considering the situation, I'm giving myself a pass for the next couple of months. Lots going on. Um, I normally do warm lemon water in the morning,
that's good.
but yeah,
That
probably
kicks
the next few months I'm forget it.
we fall off it and then we go back onto it. But the warm lemon water, it activates the liver and gets the digestive system going. And it also alkalizes the body.
Wow. Okay.
You can,
Then
a nice alkalizing drink that you can do is, a teaspoon of baking soda, half a lemon, and room temperature water, warm water. You can drink that every morning.
wow.
Yeah, I
Okay.
add a little stevia to it if I use it because, the baking soda is kind of, but you get used to it. I don't mind it. So, yeah.
Okay. And then another thing. Now, I know this has been a lot debated in the medical community, but what are your thoughts on adrenal fatigue and can acupuncture heal it?
Acupuncture can definitely help it. There's a lot of different things you can do for adrenal fatigue. There are yoga poses.
Mhm.
There are dietary changes. There are sleep changes.
I'm guessing no coffee, huh?
Decrease the coffee. Yeah, absolutely. So yeah, I, you know, I've had my own health challenges over the years. I have a lot of stuff going on with me that doctors just don't even have a clue what's going on or how to fix it or help me. Which is another reason I turned to acupuncture. They could not figure out what was causing my problems with my pregnancies, that the babies wanted to come so very early. And so, by my third pregnancy, um, I started up that road and ended up having problems, and then the acupuncture stopped it in its tracks. And so that's what intrigued me about what acupuncture could do. It stopped my preterm labor in its tracks. Walked in, contracting every 2 minutes, cervical changes. 20 minutes later, after needles, gone, never came back. My previous 2 pregnancies, multiple hospitalizations, multiple medications, preterm deliveries. Yeah.
How early did they come, if you don't mind me asking?
We managed to get my first 2 children to 36 weeks. I sat on bed rest from 24 weeks and 26 weeks. And then we managed to get it to 36 weeks. And my daughter, I started it at 28 weeks and I made it to 38 weeks. Yeah. I wasn't on bed rest. I wasn't in the hospital. I wasn't on medication. I wasn't on any of that stuff with her. And my 4th child, we had to induce. So I made full term with him. So yeah.
Wonderful.
Yeah. So acupuncture made a huge difference in my world. It stopped the debilitating morning sickness I had. I was literally crawling on the floor with it. And then it got my pregnancies to term, healthy babies. So yeah.
That is awesome.
Yeah. So it's pretty powerful stuff. And as far as treating adrenal fatigue, I've had my bouts of that, absolutely. And so I've got my books on it. I know how to treat it. So yeah, it's something that can be helped considerably. A lot of it is a lifestyle change.
Okay.
So it's a lifestyle stress-driven thing. So,
yeah. Now I'm going to ask you something, and it's going to be a little off book, but can you actually do video consultations for people in other states and things like that?
I actually treat remotely. I have
Okay.
clients in Portugal and New York and Seattle and Tennessee, Texas.
Part of the reason why I ask, I didn't realize how far my programs are going. They're going to Cincinnati. They're going to Texas. They're going all over the place. Heck, I've reached the UK, Scotland. I even reached out to Africa.
Yeah, I actually have done. Don't have very many clients, but the ones that I have treated, it's worked very well for them. So
Awesome.
I have a couple of regulars, and honestly, at first I was a little bit, when the idea came to me, can I do this remotely? Because it is just energy work.
Yeah.
I thought that's got to be kind of crazy. So I played around with some of my previous clients and some of my coworkers and, some of the problems they were having, and I treated them. And while my friend in Alaska, she was having a bad, I said, hey, let me just, let me do this for you. And I did, and she fell asleep, and so she didn't respond to me when I said, how did it go? She fell asleep, and she woke up the next morning. She says, well, it worked because I fell asleep and I don't have a headache, and I couldn't sleep because of the headache. So I had another friend in Portugal, same thing. She had a really bad migraine, and I said, well, let me do a quick treatment for you. And I was doing, because she was helping with stuff, so we just kind of exchanged services. She's a great astrologer, by the way.
Awesome.
And so she was shocked at how well it worked, and she was even saying to me at one point, I felt like I was being turned, and I use a proxy doing Reiki, so I was using a proxy to treat her. And so at one point I did the proxy face down to do the back part of the treatment, and she felt that.
Wow.
So yeah. Yep.
Well, no, I was gonna say, Antoinette, she does a lot of remote work.
I would love to do more remote work, honestly, because I enjoy it and I can reach more people.
Yeah.
So,
and then the other thing, I've got a panelist that comes on the psychic roundtable that I do on Thursdays. He's actually a psychic vampire.
Oh, okay.
But he uses the positive attributes.
Right.
So he can take anxiety and pull it out.
Okay, yeah.
And he can filter it. That way, he can do different stuff like that. And he was newer in it. So I had him work on somebody remotely on screen.
Oh, yeah?
Worked.
Oh, wow.
Yeah, wow. He was like, oh my God, I can do this remotely. I'm like, so,
Yeah.
No, he's been
Yeah.
exploring a lot of the really interesting positive attributes. Heck, I'd love to
Yeah.
have you. You know what? If I ever do a program on either energy work or psychic vampirism, I'd love to have you on it.
I might consider it. Yeah.
Just
So
to talk about the different energy medicines and everything like that.
exactly. Yeah, we could. Yeah, absolutely. Because that was the thing when I decided to try this technique, and I had no idea that anybody else had been doing it. And actually, there was only one other woman that I was connected to when I started asking these questions. That I had another acupuncture friend knew that she did it,
Yeah.
and she started it because she lived in New York and had to move over to Seattle, and her
Right.
New York clients still wanted her, and she couldn't
Yeah.
fly back all the time to do it. So she
Right.
just started doing it remote, and they were quite happy with it. And so I did talk to her quite a bit about it. And, so she did help me to understand aspects of it and that it's absolutely entirely possible. I mean, if you can do Reiki
Mhm.
remotely, you can do acupuncture remotely, you can do anything remotely.
Well,
So,
it's really interesting. I mean, my dad, yes, he's a naturopath. He's also a clairvoyant psychic medium.
yeah.
And I grew up, he's also a huge UFO chaser and everything like that. I mean, he's completely into the area.
I was in Mexico. It's everybody started to believe
And
in aliens after New Mexico. You just do. These stuff happens down there. If you
right,
didn't believe before, after you live there, you believe it. So,
yeah.
yeah.
One of these programs I'm actually going to have MUFON on here, but I'm not that far yet.
That would be
But
fun.
I grew up with my dad. He was always, talking about remote viewing, talking about all this stuff. So I grew up with all these theories. And most of the people I know don't do energy work remotely because it's just not something that crystallizes for them. But I love the ones that do because it widens their reach.
Hmm. Yeah. I mean, I'm still surprised when I do a session and people tell me that it worked,
Mm-hmm.
like stopping nausea,
Yeah.
and, helping someone. I mean, something so simple as, something like that, or helping somebody with a headache, or,
You're cutting in and out on me, Christine. You're starting to, that's okay.
yeah,
Um,
there's just been different things that I've helped people with, and I've always been surprised that it's helped them. So it's always
Now,
surprised me, even though I know it works.
the other thing is you treat migraines as well, yes?
Oh yeah, yeah.
Okay.
That was one of the biggest things I treated starting my practice. Just so many people have them. So yeah,
Yeah.
yep,
Migraines are a curse.
yep, yeah. So they are, but once you determine what the imbalance is in the body, then you can treat it that way. So,
My
uh
dad was a long-term migraine sufferer.
huh,
And then I think his mom was the one who had him. It basically just kind of followed along in the line.
yeah.
I thought I was going to be able to skip out on it, but once I started doing psychic readings, I got the curse, you know? Yeah.
Okay, yeah, yeah.
But dad managed to beat back the migraines, but
Mhm.
he had to quit coffee for a long time. He had to make a bunch of dietary changes and he had to really reduce his stress.
Mhm. Yeah, yeah.
Oh,
Some people have to do that. Some of it's driven by that, and like I said, when I do my intake, then it helps guide me, especially when I look at the tongue and I feel the pulses. It helps guide me on where the imbalance is and and some of the symptoms that you tell me, which organ system is the one being the culprit. So yeah, it's
nice.
because it can be a kidney, it can be a liver causing it. The imbalances in the kidney, imbalances in the liver. It can be one organ overacting on another. Um, that can, yeah. So
Nifty.
It's an interesting medicine. So
Have you ever treated anybody with kidney stones?
I have. um, it can help with the pain of it. Um, and I've recently been talking to somebody about it. I, at one point, had gotten some really good information from a coworker who was just a kidney stone producer. And her nephrologist gave really good advice for her to do, but it was because of her specific kidney stones.
Right.
So, yeah. Yep. So,
No, I've been seeing a lot of people walking with kidney stones lately. I'm like, whoa, okay.
yeah. It can be, well, some of it can be dietary depending on the stone,
Yeah.
what it's composed of. So you've got the calcium and then you've got the oxalate, and they're two different, and they're treated differently completely. So anyway,
Well, my darling, I think we're going to wrap up because I'm starting to get really hungry. Sorry.
yeah,
But,
I'm
um,
starting to get tired. I'm looking at the time going, I thought this would be a quick 30-minute thing. I didn't realize we'd be on for so long and have so many questions, but it's been great.
well, almost anybody that knows me I'm a huge proponent of alternative medicine.
I
Okay.
am too. Yeah,
I'm a huge one for a pinch of prevention's worth a pound of cure, you know?
that is very true. Yes.
And so I love having you on here because people are going to get the answers and realize there's another person out there to help.
Yeah, yeah.
You know?
I'm hoping that I can, help a lot of people. That was my goal of going into acupuncture, and like I said, a lot of it's education and helping them in their current situation. And like I tell people sometimes I'm just helping you learn to live with the new normal, you
Mhm.
know, and sometimes I'm helping you to understand the process and how you can mitigate it, how we can make it as easy as possible to live with it. Sometimes I'm, educating them on something that they don't even realize is going to be a problem. They come in for one thing, and then I'm like, "Oh, we got to talk about this too because I can see this could be happening." And that just comes through me sharing my knowledge and what I'm finding in their body, what their pulses are telling me, what their tongue's telling me, and explaining to them what that is. And they're like, "Well, does that mean this? Does that mean that?" Lately, I've had so much gallbladder stuff with people, and so yeah, so that's an interesting, thing too. That once you get going on that, it's yeah, but and that can be prevented a lot of times. So, but dietary.
Yeah. Now tell me again, how long have you been in practice here?
I actually just relocated back last year, so I just started seeing patients again in April.
Okay.
Like I said, I was born and raised here. I left here about 25 years ago. So most of my practice has been in Albuquerque and Tennessee. So, and I've been practicing since 2009.
Okay. And then tell people your business name, how to get a hold of you, and where you're located.
Okay. Well, it's Healing Soul Transformations. My name's Christine. My phone number that you can reach me at or text me at is 615-202-0166. I'm in the process of getting my website reactivated, and then you'll be able to reach me through that too. And it will be a web-based and mobile-based website. So they'll be able to find me on phones and anything they want to find me on. I currently have a room rented at the Unity Center, 31st and Grand location. And then I also have access to a room in Pleasant Hill at the Emporium Apothecary. It's a new, everybody knows Terry DeBolt in this town, I think.
Wondercraft.
Wondercraft. That's Emporium. There you go. Her apothecary. Wondercraft Emporium. Thank
Awesome.
you. It's so new. I can't even keep the name straight.
No, I know Terry. She was a vendor in a lot of my shows for a long time. I'm
Yeah.
really happy to see that she's actually got her own business.
Yes, it's a beautiful shop and it's got a lot of wonderful things in it. And she makes beautiful jewelry and wonderful, little concoctions and potions and lotions and all of that. And then I have a room with another practitioner in that building. So, well, in her shop at the back of the shop. So, yeah. So, and I have that room with Kim Dawson who does ART. So
Nice.
we've got all kinds of stuff going on over there. And then over at the Unity Center, of course, there's always activities going on, sound healing sessions and drumming. And they have
Oh,
AA and NA and all kinds of stuff in the church too. So
I love the Unity Center, Unity Church. They're amazing.
they are amazing. So, and there's a massage therapist there too. So they're trying to get more practitioners in there. So
Nice.
they have rooms to rent, people. So
Oh, well, I don't know. I have rooms to rent too, and I got to tell you, room rental is just not cracking.
it's rough. It depends on the pricing. And, really, it's. I'm shocked at the cost of rooms. I shouldn't be, but I
Well,
every time.
the other thing is what it costs to rent the building in the first place.
Exactly. So, yeah. But anyway, well, I've appreciated being invited onto your podcast and sharing information with you. And I'm hoping I didn't overwhelm or,
Nope.
ramble on. And I hope it's helped somebody and answered some questions and made people curious about what's out there and what can be done. Um, so, and again, I'm going to say acupuncture treats anything that walks through the door because we're just balancing your body and helping it heal itself. So, and so that's why I say when you ask questions, just send them, just come. We'll see what I can do to help. I'm just balancing you. And that's the biggest thing. So
Awesome.
yeah.
Now, would you be willing to come on and do another interview or come on as panelist for the Psychic Roundtable?
I would be willing to. That sounds like it'd be a lot of fun. This is my very first podcast, so
Oh, wow, okay.
I don't know how this is going to go. I typically, and it probably went so well because the one and only time I ever had anybody film me for a midday noon session in Nashville, Tennessee, they came with the camera crew and everything. The minute they put that on me, I just shut up. I didn't know what to do. I just didn't want to talk.
I was deer in the headlights.
Deer in the headlights. And I just was shocked that something can shut me up, literally.
Well, you're a Sagittarian, so yeah, that takes quite a bit.
It does. Well, like I tell people, I can talk to just about anything, to anybody about anything, and I can even talk to a wall if I have to. So,
But that's really a gift when you're in the medical.
It is. It really is. I learned so much about people, and I'm just really comfortable. I may not be as professional as other people. I'm really relaxed. I like to teach and talk in layman's terms. I don't use fancy high-level medical words. I ask, do you pee every day? I don't really go, do you void or urinate? And I don't want to put that down, but there's so many people when I worked in home care nursing, they didn't understand what I was asking.
Yeah.
I had to get down to their level and talk how they talked, and
Well, what is it? A friend of mine always says them fancy $2 words.
Exactly. And that's about all they are. I mean, they're very simple to explain. And a lot of people will look at things and they'll go, I don't understand what this means. And when I explain it to them, they're like, oh, that's all that is? Yeah, that's all that is. But we have to make it sound, how we make it sound in medical. So I understand that part because
intense, dramatic, more than it is. Oh my gosh.
Well, yeah, it can be.
But Christine, my dear, you go get some rest. Thank you so much for being on, and I will invite you the second I get an energy medicine panel going.
Okay, that sounds great. Thanks for inviting me, and it was wonderful to be here. And I hope, like I said, everybody got something from tonight. So,
thank you, ma'am. I'm sure they did.
All right. Night.
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 All right, folks. Well, thank you so much for tuning in, and thank you to Christine. She is amazing. She's so much fun to have on. All right, y'all. You have a great night, and try and go see her over at the Unity Center because that place is amazing anyway. All right, guys. This is going to be on Des Moines New Age Radio on Spotify. Check us out and follow for new episodes and more content and gem talks and interviews and all that fun stuff. And like and subscribe. And if there's a topic that you want me to cover or somebody you'd like me to interview within this realm, of stuff, the metaphysical and alternative health and UFOs and all that fun stuff and cryptids, let me know. All right. Like and subscribe for more content. And now I am going to do the outro. We don't have an intro, but we do have an outro. Thanks, guys. Love you all. Mwah. See you on the Psychic Roundtable for Norse Paganism. And Wednesday night on Alicia's Desk, interview with Dean Sturtevant about his upcoming Under the Sea art show. Love you all. Ah.